Have you ever wondered if everything we know about oral health might be wrong? An intriguing proposition, isn't it? We've been taught that brushing twice a day, flossing, and regular checkups are the holy grail of dentistry. But imagine if those long-standing practices were about to be revolutionized, turned on their head by groundbreaking findings in the world of oral microbiome. We're not just talking about a minor tweak or a small adjustment. We're discussing a seismic shift, a radical rethinking of what we've held as gospel truth. This is about the evolution of dentistry, where the old norms are being challenged and the status quo is on shaky ground. We're on the cusp of a new era where we're beginning to question, to probe deeper, and to redefine our approach to dental care. So, are you ready for this intellectual adventure? Let's delve into the history of dentistry to uncover how we arrived at today's practices. Dentistry is an art and science that has been practiced since ancient times. It's a fascinating journey that begins with the earliest humans, who had a rudimentary understanding of oral health and its importance. In the realm of prehistoric dentistry, tooth extractions were performed with primitive tools, often resulting in more harm than good. The earliest known dental procedure dates back to the Stone Age, where people used flint tools to drill holes into teeth to relieve pain, a far cry from our modern understanding of oral care. Fast forward to ancient civilizations like Egypt and Rome, where dentistry took a significant leap forward. The Egyptians were known to have used gold wire to bind loose teeth, while the Romans understood the concept of dental prosthetics, creating early versions of false teeth from bone and ivory. The Middle Ages brought about a shift in dental practices, with barbers doubling as dentists, performing tooth extractions, and even attempting to treat cavities. However, it was during the Renaissance that dentistry began to resemble the profession we recognize today. A French surgeon, Pierre Fauchard, often referred to as the father of modern dentistry, published Le Chirurgien Dentiste, a comprehensive guide to dental care, which laid the groundwork for many of the practices we still use. The 19th and 20th centuries marked the advent of significant advancements in dental technology. Anesthesia was introduced, making dental procedures less painful. The dental drill was refined, X-ray technology was adopted, and fluoride was recognized for its preventative properties. These developments revolutionized dental care, transforming it into a sophisticated science. In the past few decades, we've seen an explosion of technological advancements that have propelled dentistry into the 21st century. From 3D imaging to laser dentistry, CAD/CAM technology to dental implants, the field has become more precise, more efficient, and more effective. This historical journey has led us to the current state of dentistry, but are we on the brink of a revolution? As we delve deeper into the understanding of the oral microbiome, it's clear that we're standing on the precipice of a new era in dental health. So buckle up as we journey into this brave new world. Traditional dentistry has long held certain beliefs as sacrosanct. This is the foundation upon which generations of dental practitioners have built their practice and prescribed their treatments. Let's explore these key principles that have become the cornerstone of dental care. First and foremost, traditional dentistry places a significant emphasis on the removal of bacteria. From the moment we take our first trip to the dentist, we are taught that bacteria in our mouth is the enemy. We're told that these microscopic invaders are responsible for tooth decay, gum disease, and bad breath. Accordingly, the primary goal of our daily oral hygiene routine becomes the eradication of these bacteria. The arsenal in this battle includes toothbrushes, toothpaste, dental floss, and mouth rinse, all designed to scrub away and kill these unwanted guests. Secondly, the importance of regular brushing and flossing is drummed into us. We are encouraged to brush at least twice a day and floss once a day. This daily ritual is seen as the cornerstone of maintaining oral health and preventing dental diseases. The underlying belief is that the more frequently we clean our teeth, the less chance there is for bacteria to accumulate and cause damage. These practices have become the standard of care, and they have served us well. For years, they have been instrumental in maintaining oral health and preventing severe dental issues. They form the basis of what we know and understand about dental hygiene. They are the practices that have been passed down from dentist to dentist, generation to generation. However, the world of dentistry is not static. It is a field that is continuously evolving, with new research and findings challenging the status quo. Traditional dentistry, with its focus on bacteria removal and regular brushing and flossing, has been the norm for so long. But what if these practices are not the full story? What if there's more to oral health than what we've been told? The world of oral microbiome research is bringing forth fascinating insights that might just challenge these long-held beliefs. So, let's dive deeper into this revolutionary world in our next segment. Recent research has begun to unearth a new understanding of oral health, focusing on the oral microbiome. Here, we're not just talking about teeth and gums, but an entire ecosystem living within our mouths. So, what exactly is the oral microbiome? Picture a bustling city teeming with diverse populations. Now shrink that city down and place it on your tongue. The oral microbiome is like that city, a complex community of microorganisms, including bacteria, fungi, viruses, and more, all cohabitating in your mouth. And just like any city, maintaining a balanced community is crucial for its overall health. Our understanding of this microscopic metropolis is still evolving, but scientists have already discovered that it plays a significant role in our oral health. The microbiome helps to break down food, protect against harmful invaders, and even communicate with our immune system. It's a delicate balance, and when it's disrupted, problems can arise. This is where we begin to challenge the traditional dentistry dogma. Historically, the approach to oral care has been somewhat of a scorched earth policy. The belief was that all bacteria in the mouth were harmful and needed to be eradicated. This led to the development of powerful antibacterial mouthwashes and toothpastes. However, new research suggests that this approach could be doing more harm than good. You see, not all bacteria are bad. In fact, many are essential for maintaining a healthy oral environment. When we indiscriminately wipe out bacteria, we're not just eliminating the harmful ones, we're also taking out the beneficial ones. This can disrupt the balance of our oral microbiome, potentially leading to problems like tooth decay, gum disease, and even bad breath. Furthermore, scientists are now discovering connections between our oral microbiome and overall health. Disruptions in the oral microbiome have been linked to diseases such as diabetes, heart disease, and even certain types of cancer. This suggests that maintaining a balanced oral microbiome could be integral to our overall well-being. So, where does this leave us? Well, it's clear that our understanding of oral health is changing. We're moving away from the idea of a sterile mouth and towards a more nuanced view that acknowledges the complexity and importance of our oral microbiome. We're beginning to question the dogma of traditional dentistry and consider new approaches that focus on maintaining a balanced and healthy oral ecosystem. This isn't to say that we should throw out our toothbrushes and floss just yet. Cleaning our teeth is still crucial, but perhaps we need to think about it in a different way. Perhaps it's less about waging war on bacteria and more about fostering a healthy, balanced oral community. With this new perspective, could we be on the verge of redefining dental care? As we continue to delve deeper into the fascinating world of the oral microbiome, only time will tell. As we step into the future, the dental field stands at the precipice of change. The traditional doctrines of dentistry, built on the foundation of combating oral bacteria, are being challenged by the revolutionary insights of the oral microbiome. The implications of these new findings are massive and far-reaching. They promise to completely reshape our understanding of oral health and the practices we adopt to maintain it. Dentistry as we know it might be on the brink of a paradigm shift, one that is more harmonious with our body's complex ecosystem. Imagine a world where dental treatments and preventative measures are based not on eliminating bacteria, but on nurturing a healthy, balanced oral microbiome. A world where tooth decay and gum disease are combated not with aggressive treatments, but with targeted interventions that restore the natural balance of our oral microbiota. This is not a futuristic fantasy. It is the direction in which the dental field is moving. Researchers are already exploring the development of probiotics designed specifically for oral health, paving the way for treatments that work with our microbiome rather than against it. The potential of this approach is staggering. It could mean fewer invasive procedures, less reliance on antibiotics, and ultimately, a healthier oral environment. But the benefits extend beyond our mouths. A healthier oral microbiome could have implications for our overall health, influencing everything from our digestion to our mental well-being. But as with any revolution, this one comes with its challenges. The transition from traditional approaches to microbiome-focused strategies will require significant shifts in thought, research, and practice. It will demand a willingness to question established norms and embrace new paradigms. Yet the promise of a healthier, more holistic approach to oral health makes this journey worthwhile. The future of dentistry, driven by oral microbiome research, could redefine our relationship with our oral health, making us active partners in maintaining our well-being. This revolution in understanding could lead us to a healthier smile than ever before.